Hello, everyone. This is Mark Anthony with AI Edge Podcast, the place where we bring you the best of the best doctors in their niche. Today, I have a special guest, Dr. Margaret Boltja, MD. And today, we're going to be talking about what is PRP and what does it treat. We're going to talk about not just treating, but symptoms and also some really cool things that Dr. Margaret does in her office on helping people. Her focus, from what I've seen just talking with her, it's not about putting a Band-Aid on people. It's about finding the root cause and allowing them to feel better and their body to regenerate back to at least the best optimization that person can be to have a good life. Today, you can also find her at Mid Gap Pain. I'm on Mid Gap Pain. We're having fun here, guys. So Mid Gap.
Mid Georgia Pain, MD.
Mid Georgia. Oh, I see. You know what's weird? I see. Yeah, we're going to have fun with this. What I saw was midgapainmd.com.
Midgapainmd.com.
Okay, cool. See, I can't say that. All right, guys. Yeah, that's why I'm on this side and she's over there. So, all right. Anyways, we're having fun here. And I just want to let all the viewers out there know. There's a lot of podcasts that are just going to kind of throw fluff. They're going to try to make it so professional that it's crazy. I think it's great, but we also want to have the organic feel because, guess what? We're humans. We're not robots. And good thing it's not because, the Transformers haven't taken over yet. So we're going to have fun today. So Dr. Margaret, thank you so much for being here.
Thank you for having me.
Of course. So what is PRP and what does it treat?
Well, platelet-rich plasma is basically when, in layman's term, it basically can help with, in my world, and when I use it, it's for pain. They use it for aesthetics and other things as well. But basically, it's when you get your blood drawn and you put it in a tube and then it gets spinned down and there's different ways to prepare it depending on what type of injury you may have, whether it's tendon, muscle, nerve. So there's different ways to, based on these issues, you get it's injected back into your body to help with regenerating and using your body's own growth factors to heal and hopefully feel better and be stronger and be healthier. So that is regenerative medicine and orthobiologic medicine involves sort of a span of different types of these modalities, and the main one that I focus on because it's extremely expensive is the platelet-rich plasma. There is also BMAC, bone marrow aspiration concentrate, which also requires a different type of filtering the cells, but it's basically getting from your hip some tissue from the bone in the iliac crest of your hip, and anyway, spinning that down. And again, it's a very potent and more of these growth factors in your own cells, and it tells your body how to sort of fight off infections and inflammation. And so that's even more potent, and you can actually put that in the knee bone, different areas for hip bones, knee bone, where you see abnormal MRI imaging in the spine. And then there's also adipose tissue that is used, and that is extremely potent with these stem cells. So, but again, all this is supposed to offer another option where it seems to be, the data is really I'm starting to see new studies, coming across my emails all the time about ways this benefits pain, whether it's tennis elbow, knee arthritis, neck pain, back pain. It's just fascinating to me.
What are some of the things that you've seen that it's helped and you've just been like, wow, I'm shocked how well it's helped?
Well,
people?
I think that, I go to quite a few conferences related to this, and it's just interesting to me. And I have it where, for example, in the spine, discogenic disease in the spine, and after you have certain types of a combination of stem cells or PRP, there's just a lot of it's just fascinating how you can kind of see the results of the improvement. And you also see improvement in the MRI imaging. So there are a lot of studies that are showing that it's just a huge improvement in the imaging after this has all been given. And usually there's, patient benefits from all. I've heard, I've had experience with, it could be anywhere from tennis elbow to, hip pain, bursitis in various places. And then there's joint pain, knee joint pain, again, neck and back, actually carpal tunnel syndrome. There's a great there's a great way to use regenerative medicine to treat the carpal tunnel, and there's some people that have results with this where they really can avoid surgery altogether. So it's
Wow.
now, if it doesn't work, of course, 100% for everybody. If you've really got the worst looking case of osteoarthritis in your knee, or so you've got major mechanical issues, then it may not. That's probably not going to completely help that. So you have to take everybody individually.
Okay. So PRP, which is platelet plasma, how does that work? They spin the blood, right? They spin the blood to activate the cells inside the blood and put it
Well,
back
there's
inside
different ways to spin it down, but that's why it gets into some details more. In some areas, you want to use platelet-rich plasma, which is PRP, and there's some cases that it's better to use the platelet-poor plasma based on what type of tissue you're treating, nerves, muscle, tendon. So that's kind of where that comes from. So there's different protocols. So, and yes, they have kits. There are different types of kits out there that once you spin it down for so many minutes, and how, there's a science behind all this. And after you spin it out, sometimes you spin it down twice and you add other things to it. So it's definitely, it's fascinating actually. So, but there's different, all that to really maximize the best growth factor, and where your body's regenerating and turning on signals to reduce inflammation and all that to help the whole matrix in your cells.
So what I'm hearing you say is that the PRP helps bring down inflammation, and can PRP help without having to go into surgery a lot of the times?
Right, you can't say that 100%. I would not say that percent. It depends on what's going on. Usually the whole idea is to try to do that so that you can avoid that.
To prolong it.
Yes.
Okay.
And help with healing. And it actually, it basically induces an immune response actually to help heal and everything. So you have to give it time. There's different ways to rehab your body after you've had a PRP injection, different physical therapy or movements and things like that to really get the maximum benefit. And everybody's different depending on your age and your comorbidities. You have to be careful of patients. It doesn't really work all that well if you're on antiplatelet therapy, chemotherapy, things like that. There's a lot of factors that have to be taken in consideration.
Right. So not everyone is not accessible to it and that you recommend. So it just depends on things that you've been through, or if there's anything in your body that could fight against it.
Right.
Okay. So with utilizing PRP, are there any, maybe I don't know, I know that we can't use facts. So we can use maybe stories that you've seen or even heard in your practice where you were shocked. Well, this person, so forth, came in, we'll call him Bob, came in, and you noticed that there was a major difference. Wow. And he was amazed, or she. Any testimonials or things that
yeah, there's definitely testimonials, especially with the knee pain. And again, tennis elbow is great for it. Sometimes bursitis, subacromial bursitis, and the impingement syndrome of your shoulder. Yeah, we definitely have patients that do well with it. And sometimes it requires one or two times of doing it, and it's awesome.
That's awesome. So,
and the other things, you get to use the ultrasound. Got on some of the injections, you use fluoroscopy, just like I do with all my other injections that are not regenerative. But I'll also offer patients, steroid injections as well for different. Everybody you have to be looked at individually. So, but that's why it's so interesting, because you can have a choice.
So you mentioned tennis elbow. So it works pretty good on something like that. And if so,
that's actually that's also where there's a lot of evidence-based medicine that actually kind of shows improvement with that.
Really?
So that's kind of where the data. I tell people that, and this probably is changing as we speak, but there's, the best data out there is the benefit of this for knee osteoarthritis and for tennis elbow. So, and like I said,
that's awesome. And let's say somebody they have PRP. How long does it last? I know that everybody's a little bit different, but does it last a while?
It depends on your rehab, how well you rehab it, and the strengthening and all that. So it depends on how healthy you are. It's hard to, it can be a year, more than that. So I see the whole gamut, you know.
Okay, I see what you're saying. But bottom line, you're not in pain for the year. I mean, it's really about health and wellness to allow us to enjoy life as long as possible because none of us are really getting out of here alive. So we might as well enjoy the modalities that we have to help people get better.
Well, that's the most fun part. And you do that, do this in combination with some dry needling or other TENS unit, things like that. You kind of have to, it's good to mix, add different things that help.
Really? So you do dry needling in your practice. So how does that look like and how does that work, dry needling? What's the pros on that?
Well, it's like a form of acupuncture, dry needling. And it depends on what state you're in, but most in Georgia where I live, physical therapists can get certified in dry needling. So in some states, chiropractors are the only people who are certified and physicians. So I actually did get certified in medical acupuncture, which was just very fascinating. And you can put the needles, basically it's a form of acupuncture in that you have, like, say, neck pain, myofascial pain in your neck or wherever it is, and you put the needles there and you can hook the needles up to their acupuncture size needles. So very tiny. And then you can hook them up to an electrical stimulation and increases the circulation in that area. So that's pretty cool.
That's awesome.
I can do it. I have my needles, but because of the kind of the workflow in my practice, I don't really do that as much because I don't really have time to, I usually just refer out to physical therapy and have them, they usually do that. So.
Okay, that's awesome. So in your office currently right now, like maybe tell us some of the modalities that you're utilizing in helping people, which we do know is PRP. If you can maybe just give us a list of stuff so that your viewers out there that are looking for, help in your area, they can kind of see that, hey, you don't just do PRP, but you also do, so forth,
Yes.
so forth.
Well, I treat pain anywhere from head to toe. So
okay.
Headaches down to neuropathy type pain in neck and back and joints. So depending on whether it's neuropathic, I do ultrasound guided injections and fluoroscopic guided injections, as I mentioned before. Some of the things that I recommend are, like I was telling you, the dry needling and the TENS unit, and I don't necessarily do that in my practice, but I do mostly those types of injections that I just mentioned, and this can be either traditional, a one every once in a while. If you have acute inflamed herniated disc and you don't want to have surgery, you need actual steroid injection to help with the pinched nerve of your neck or back. I mean, there's plenty. I get great results from that. That's amazing. I just try to always tell my patients the risk and benefits of the steroid and numbing medicine, and also offer, of course, the PRP as well. And another way we treat neuropathic pain with regenerative medicine. But most people have insurance, and so unfortunately the PRP is cash pay, right? So.
Right.
A whole different, you have to, some people don't have that option. So what else? There's also something called, as far as there's different blocks that can help with pain. Especially there's something called complex regional pain syndrome, and that's when you have severe pain, like after surgery, some kind of trauma.
Wow.
Surgery, it's burning. Sometimes it requires something called like a sympathetic block, and if it's in the foot, or stellate ganglion block if it's in the hand. That kind of thing is something I do that helps a lot, and that is basically putting numbing medicine in sort of the sympathetic and parasympathetic nervous system, and blocking it sort of to calm down your nervous system. And so that actually can help a lot with different types of pain due to the pain pathways and such. So also there's something for severe headaches, especially if you have runny eyes or runny nose, severe headaches that have not responded to, the usual medication. These can be migraine headaches, trigeminal neuralgia, cluster headaches. For this type of pain, I have very good results with something called the sphenopalatine ganglion block.
Oh, yeah.
And that is a procedure that you have lidocaine numbing medicine placed. I usually do it intranasally with the catheter under fluoroscopy. So it is usually, some people do this also with a needle. And anyway, it is very helpful for that kind of pain, to try to break the cycle it sort of resets your nervous system. So those are, it's just very, I just love being, I've done general neurology for several years now and was doing Botox, which I do that as well. Botox is another great tool to help with dystonia, my pain related to torticollis and also migraine headaches. So I've done those occipital nerve blocks, and but I find this after I did the interventional pain fellowship and just going back to that and learning about that, it's just been so nice to be able to offer so much larger range of things to help my patients. And sometimes you have to resort to medications, and that's been, I have a lot of things to choose from in that area. What else? So yeah, it's very
Wow, so
it's very cool.
that's
And sometimes
interesting.
I have a hard time doing it. Sometimes I have to say, you know what? You have tried so many things. It's going to be this that we've really got to lean also on pain psychology. Pain psychology is especially if you have anxiety and depression, fibromyalgia, there are some people out there who are very, very sensitive to pain, and it's just not fair, really. But we have to recognize that and say, let's get a plan to work on things that can try to help with this from a standpoint of learning how to cope with pain and using like box breathing and different exercises to get through a pain and not let the increased anxiety and catastrophizing get the worst of them. They have to kind of learn how to deal with these attacks. And usually most people say, yeah, you're right. Whenever I'm under a lot of stress, a lot of anxiety, yeah, my pain is worse. And so we have to realize that a lot of this is all very related. All these chemicals are all in the same place. So yes, there are pain psychology apps out there that I refer out to, and I also recommend things like acupuncture and yoga, even chair yoga, because I have tons of patients that it would be too dangerous if they tried to try, fancy yoga. So yeah, all these things are out that we have to bring up. You have to bring this stuff up.
With the headaches, let's talk a little bit more about that. So what are some of the things that you do or you help people with headaches? What's your process?
Well, you have to get the history and figure out what kind of, what type of headaches are they having? Make sure, after trying different types of medications, whether it's a preventative therapy, which is something you take every day for chronic headaches, or if it's just an as needed therapy. Everybody's different. You have to kind of gauge that. If there's, you have to make sure you get imaging to make sure we're not missing anything like things that can cause secondary headaches, right? Infection, inflammation, cancer, things like that you don't want to miss, right? So that's part of it. And checking some labs if necessary to see if there's inflammatory markers and making sure, like I said, a lot of this is making sure you're not missing anything serious that needs to be treated medically. And then, so if it boils down to, a primary headache problem, you got to figure out what kind it is. And then you can do medication is the main thing. And then of course, again, you can also do trigger point injections, occipital nerve blocks, other things to help. A lot of times what I also love now is that when I'm doing headaches, so much of the headaches are caused by neck pain, and we call that cervicogenic headaches, of course. And it's so once you end up realizing, oh my gosh, we got to see what's going on in the neck, you get an MRI and you realize there's tons of arthritis in the facet joints and issues with the neck. So you treat that and all of a sudden their headaches get better. So I get to kind of help with all that, which is fascinating. I have a lot of people with arthritis in the facet joints in the neck, and that facet joint arthritis it's when you have pain that's worse with extension and turning. And there are some procedures that medial branch blocks, radio frequency ablation, that they really, really help with that and improves people's quality of life to do that, to help in causing less headaches. So, and then unfortunately, like I said, the sphenopalatine ganglion block is also something I'm having great results with as well. That's the procedure I was telling you about earlier, where you lean back and you put the catheter intranasally down there and enter the numbing medicine. So that's a really good one as well. And the Botox injections.
And where do you is that Botox injection right here normally?
Usually with chronic people who have primary migraine headache and they've tried all the preventative medicines like seizure medicine, like gabapentin, pregabalin, Depakote, and they've tried antidepressants, they've tried blood pressure medicines such as beta blockers or calcium channel blockers. All those are kind of go-to. Then they have, the CGR, what we call CGRP receptor antagonists, and those are the newer medicines that help with chronic headaches. But anyway, Botox helps with preventive medicine. So it's basically 31 different injections. So it would be in this area down
Wow.
here. Basically, it paralyzes the muscle that it is injected into. That's all it does, is it
Oh,
paralyzes.
wow.
So much of this is related to tension. So I've been doing that for many years, and it's very effective.
Wow. So it's blocking that sensory from.
Well, it's actually no, it's just paralyzed. It goes into the muscle and paralyzes. So a toxin that kind of,
Wow.
yeah, it's botulism toxin. It's toxin, and it's very cool.
That's
So
smart.
it relaxes the muscles that it touches. And there now when it comes, they're also do nerve blocks in the face, like for trigeminal neuralgia or any other kind of damage from like sinus surgery. Sometimes if you go and if I can do little blocks in these different maxillary supraorbital nerve block, they're blocks for different facial pains that are very, very effective as well. That's also very, it's just nice having the whole gamut of things to try for. There's also something called neuromodulation, which is when in some of this, like for example, there's a stimulator, a vagal nerve stimulator that you can use to try to help with headaches. These things are also somewhat effective.
Wow. So you help a lot with headaches, which is a lot of people have a lot of headaches out there. I mean, especially migraines. There's different types. Migraines are probably one of the worst because a lot of that has to do with vomiting, at least some people, because they're in so much pain. I know I had migraines for 35 years
Wow.
and got help. I was getting it was so bad to the point where I knew I would take 2 days off near the end of the month because I knew that's when I was going to be not feeling well. And I'd be in a room, pitch dark, and just sleep
Yes,
because I was in so much pain. And
Great.
it's been almost 10, no, about 7 years now since I've maybe had 2 migraines if I'm lucky in like 7 years. So it's also learning your body. What are you eating? What are you putting
Sure.
into it? A lot of people don't realize that as they get older, they get sensitive and they get allergies. And if you don't know your body type and your blood type, you're going to have a problem.
Yes.
Yeah. So I know a little bit about migraines and
You could write
but
the book on it. I'm glad you're.
oh my. Oh yeah. One thing I've learned too is your water makes a big difference. A lot of people don't realize that. You know, I drink Crystal Geyser because it has the vitamins and it's got all the minerals, the original minerals inside them. It comes off the glacier. They don't modify it. And our bodies are missing those minerals. And if we're not getting those minerals, your brain's going to be like, wait a minute, why are you giving me this water with lead in it? So anyways, yeah, I get all excited about water and migraines. That's my specialty. No MD there, just Mark. But
That means
yeah,
a lot. And I'm glad yours are better. That's awesome.
yeah, it's interesting. A lot of people don't realize about their migraines is there's quite a few things. It's what are you stressing on? What's the focus? You know, if I was a doctor, I'd be like, all right, tell me about your past. Tell me about what's stressing, what's bothering you. There's a whole bunch of triggers. And now, okay, how do you calm that down? You know, and not just that. Now let's talk about your food. What type of food are you eating? You know, what's your go-to emergency food when you're starting to feel kind of depressed and sad and stressed? You know, a lot of people do that. I was one of those guys. I would get to the point where I'd go, okay, I'm stressed. I need a Twinkie or something, man. And I would eat 2 or 3 Twinkies and just go to sleep because I knew that I was, stressed. But we don't realize it's hurting our body and it's going to come out. And it will come out. You know, whether 1 or 2. I say 1 here, which is the worst thing to do. But water hydration's huge. A lot of people are dehydrated. You know, if you're saying, well, I'm thirsty, that means you haven't been drinking throughout the entire day, which will restrict the blood vessels. And yeah, sorry, I'm over here talking about water now. You know, it's water. People don't realize how important water is. And that goes with everything, whether it's neuropathy, whether it's any type of pain you have going in your body. Because if you start drinking a lot of coffees, I mean, I don't know. What do you think? Do you think a person that drinks a lot of coffee, they're going to probably be more prone to migraines, would you say?
Well, I have to explain to people that it's that caffeine is usually in some of the medications acutely it can help with headaches. Like, some people just need a Dr. Pepper to drink now after they have the migraine.
Right.
But and same with ibuprofen or Excedrin migraine or Fiorset. Well, at the same time, you have to worry about something called medication overuse headache. You cannot take it every day because it causes rebound headaches. So so I try to tell people who are having a real, issue with headaches, I'd say I would taper off of caffeine for a while so you can get that out of the picture. And then once things get better, and then, you just kind of bring it in, just do it every now and then, try to do it every now and then, don't do it every single day until things get sort of stable.
Yeah, I agree with you 100%. People don't realize it. See, they're hooked on the caffeine, but they're really not hooked. What it is they're hooked on the warmth. it's a psychology thing, and like if I try to help somebody with, I'm saying like migraines or something, I'll be like, and they're like, I'm not going to give them my coffee. Okay, this is what we do. You put this much coffee in there in your cup, and I want you to put this much warm water because it's
Mhm.
all psychology. People don't
Mhm.
realize that you don't need that coffee. I drink coffee. I don't need it, but guess what? I love the warmth. I like
Mhm.
the way that I think that it makes me feel, but I know it doesn't.
Well, I like the green tea. I do one green tea.
Oh gosh, I love green tea.
Yeah.
Oh yeah, I could drink that all day. So with all these modalities, so you do dry needling if you want to, but you know how to do it. You like to
Personally.
outsource that.
Yeah. It's
Okay.
yes, it's if I now with my busy practice and like I said, it's too much for me to work in, basically. So I just refer out. And in Georgia, like
Mhm.
I said, physical therapist or or the main, or, they usually do that. But it does
Okay.
help with some people. You have to do it. It's not like one time it's going to help, and I refer out also to chiropractor, physical therapists, all of the above, anything that's going to help, try them out.
Hmm.
And I'm a huge believer of shockwave therapy
I
as well.
love shockwave.
So that I'm in the process of possibly, investing in that as well, because I would love to offer that, and so I'm definitely gonna be that'll be in maybe in the 5-year plan. But right now, so it's a process, right? But I'm a big
No,
fan of it. If
100%.
that helps, absolutely. Red light therapy is another thing I actually have a red light therapy option, but it's again cash pay, so it's not like,
Mhm.
but I have some results with that. But again, it takes several times, and it's not like I just push a button and everything's fine. So that's kind of those are some of the modalities that I think are really nice to be able to offer. There are spinal cord stimulator devices for neck pain, back pain that I also recommend to some people if given the right candidate. If it's a very and then there's peripheral nerve stimulation out there as well, and that's when you have where you have maybe some severe hand pain or company. Basically, you're basically stimulating the nerve in the periphery so it tricks your brain so you can't send the signal back to your brain. Say you're in pain. That's another fascinating thing. That
Hmm.
very that there's a lot of improvements there that they've made with that as well. But I enjoy doing the peripheral nerve stimulation and the spinal cord stimulation as well. And then there's also another thing that which I have not started doing in my practice, but there's IV ketamine that helps with chronic pain, anxiety.
Yeah.
In some people, that's an option. I've had people who have had good results with that. I've had some people that didn't do any good, just like anything. But it's nice to be able to have these things. So
That's awesome. That's a becoming very, very well known, even though it's been around for a long time. I know they used to use it in
right.
the war, I believe, for veterans and people like that, because it's also, I don't want to call it a blocker, but I know just enough to get in trouble. But I know that it's helping people like with trauma and stuff like that. I like what you said. It doesn't work with everybody, but it does work. Everybody's body's different. So it's
Yeah.
like,
And
I mean, if this, you're right.
I just love enjoying because everybody's different. So you have to really, talk and try to really get a good feel for what's going to work based on their medical problems, all the medications they're already taking, what they've tried. You have to bring everything into the picture. So there's something called central pain syndrome. It's one of the most difficult things to treat. And so, for example, if you've had a stroke involving the left thalamus, and all
Right.
of a sudden you have this right-sided pain all on the right side of your body, and it is the one of the most difficult things to treat. But sometimes antidepressants and anticonvulsants, which are seizure medicines, sometimes they do help. It you have to try. But again, all this is things that are out there. They're out there. There are things out there also that there's another thing that's a part of acupuncture that I took a course in, and it's transcranial acupuncture, transcranial scalp
Wow.
acupuncture. So if you have this, like for example, the thalamic syndrome that I was just talking about, you can go in and put the needles in the brain on the other side in the area and stimulate it.
Wow.
So I thoroughly enjoyed that, and it's just again, you can do it's just the coolest thing. But I don't do it all that much now because of the fact that it's just the workflow. I can't do everything, and that would take a
Okay.
lot of time for me to put the needles in the head and sit there, and you have to literally by hands, stimulate the needle. But that's also been very, very helpful in some patients.
Wow, you have all these
Called
beautiful
scalp
toys.
transcranial scalp acupuncture.
Oh wow, wow. Okay,
There's
that's
a
a
guy,
mouthful.
Dr. Jason Hung in Phoenix, Arizona, and I went to Arizona and to go to the course and see, and it's pretty fascinating. So,
Yeah, those it's interesting what you can do with needles. It's these pressure points that we never
mhm.
realize that actually work and our body needs because it gets this buildup. Our body gets this buildup, whether it be stress, whether it be sitting at a desk all day. You know, people don't realize that if you do sit at a desk all day, you do interrupt blood flow because the body was not meant just to be there like a pod.
Mhm.
If there, I don't want to say if there was, but like I noticed that you're busy a lot. What would you say you notice that you're busy with a lot? Like what are one of the, what would you say like one modality that you've noticed that we've been busy in this area a lot lately?
Kind of like all of it, just everything I've mentioned, everything's
Wow.
neck, back.
Yeah. Did I hear pinky toe in there? Pinky toe pain?
No, neck and back pain
uh,
is what I love the most. I did, and then headaches and then some joints here and there, which are really, like shoulder and knee. And I mean, I've done some nerve blocks everywhere from facial to foot, but I'd say my most common is the neck and the back. People are just full of that. And I try to also bring up weight loss if that is an issue. And that's tough too, because that's if we can work on that, that would be obviously help with the pain. And that can be very challenging. So, but yes, I do, it's the neck and the back pain is definitely very busy. And
I love that. Okay. So as we start to land the plane today, we talked a little bit about PRP, which you're doing in your clinic, which is what I hear, spinning the blood, activating those stem cells that are maybe dormant so that we get more of a better blood flow. We talked about need a little bit of needling, some of the dry needling that that you were certified in. But hey, you know what? You're busy, so you're like, I'll send it to somebody else. Headaches. We learned that a little bit about headaches, and which it seems like that's kind of like a real something that you specialize in. Because I would say 90% of the world is probably having headaches just with what's on the news around the world today, So they're like, oh, I'm coming in. You're like, I know, I saw it last night. I saw the post. We'll be right in there. Thank you. So if you wouldn't mind just telling all the viewers basically where you're located, where they can find you, and your website, and maybe the radius that you normally kind of help out, like the surrounding areas.
well, I am located across the United States from you in Georgia, in Middle Georgia, Macon, Georgia, Macon, and that is where there's a lot of music history there. And Otis Redding was from there, and the Allman Brothers lived there a little bit. Anyway,
Well,
I live in Macon, Georgia, and then I'm in two other Macon, Warner Robins, and Dublin, Georgia.
mhm.
So it's Mid Georgia Pain MD, and the website is midgapainmd.com. Okay. Yeah, the phone number is on the website. And again, you just make a phone call or you don't have to have a referral to get an appointment, but so we take almost most insurances. And again, I'm in 3 different locations. So Macon, Warner Robins, which is right near the Warner Robins Air Force Base. And then there's Dublin, which is a little bit further east on 16. But if you have the two interstates, I'm right where I-16 meets I-75. So that's where it is.
That's awesome. So thank you so much for being here on the show today. I love your professionalism, what you're offering, and the most of all is you're helping people. So people out there, if you're struggling with migraines, you know who to call. You know who to go see. If you're looking at you've got pain, whether it be in your back, your neck, I forgot no pinky toe, but neck, back, just any
Anytime.
type of pain. Yeah, any type of pain. Yeah.
Neuropathic pain is so common and it is so hard to treat. But I love, I do have some options, both medication wise and procedure wise, that may help. So,
Yep. And my thing to you out there, my friends, don't give up just because you think that you've seen everybody, you haven't. Give Dr. Margaret a shout out. Come see her. And again, I want to say thank you so much, Dr. Margaret, for being here. And I look forward to hopefully in the future maybe having you here back on the show.
well, thank you very much. Appreciate it.
Of
Appreciate being
course. Of course. God bless you.